the post void either supine or upright. So what I'm gonna do right now, she's going to get up and go to the restroom, okay? And we're gonna do the image upright. What's the reason I wanna do the upright voiding?
For the mobility of the kidneys.
Mobility of kidneys, or what are we looking for? Go ahead, Mama, can you stand up for me? What are we looking for? We're gonna use that vacuum.
Contrast in the bladder.
But more specifically, what kind of pathology?
The bladder is drooping.
Prolapse. Yes. So I'm gonna label this erect, right? Because remember, you always have to label your images and put the marker. How important are the markers nowadays, guys?
So important.
So important, right? Doesn't drive you crazy. Okay, so I'm gonna find for the iliac crest, which is pretty much where she's at right now. Sorry, is this okay here? Okay. So I'm gonna use my tube, center to the Bucky. What is gonna be my SID? What is gonna be my SID? Can you hold that?
40.
Center for me at the iliac crest. So 40 SID, okay? Can you see it there? So we might have to reposition the kidneys a little too low. See how the kidneys move when the patient stood up? So mobility of kidneys. Maybe we're gonna go a little bit lower with our centering because, go ahead, since you're on that side. A little bit lower with our centering because now remember it says you might center a little bit lower than the iliac crest because when the bladder moves down, you wanna catch that all the way the prolapse. So this will be your upright host void. Now, not voiding, host void. Now, one important thing, when the person went to the restroom, you guys gave one of this. What's the purpose of this one?
To catch kidney
Catch the
stones.
kidney stone if the patient that we are doing, it's, you wanna hit the light for me, please? Thank you. Post void, rect, and then erect. See that? Any questions for your post void? Now, let's say the patient, you know, when you were in the 15 minutes and you were looking at the obliques, okay? You were looking at the obliques and there was not contrast, was not visible in the bladder yet. One side was going through, but the other one wasn't. So there is a delay of the contrast, the pelvises of the kidneys pushing that contrast through. There's a delay. So which image should I be doing?
Prone.
Prone. If the doctor says, no, give me, I wanna see if the kidneys are moving, then I'll do this one. I'm gonna do an upright, but I'm not gonna label it post void. I'm gonna label it what? Just upright and your time, okay? And you might put delayed image if you have markers or annotate delayed, okay? Yes.
Still put timer marker on the void, post void, or no?
Not on the post void. Usually it's when you're looking at the contrast, especially before the post void. All those images you label, you put markers. Now, let's say the doctor says no, still I don't see contrast in the bladder. Give me a supine to see if that helps to push some of that contrast.